Act and healthcare subsidy extensions. Speaker Johnson refused to engage in that debate. He kept Republicans home for over a month so that they would not negotiate and figure out a problem on healthcare. President Trump, Vice President Vance, they did the same thing. They stuck their heads in the sand for the entirety of a 30-day government shutdown where we were urging them to come to a solution on extensions of ACA premium subsidies. I hear what they're saying about subsidizing the industry. Lord knows I'm not in favor of that, but as you mentioned, there's urgency to this issue.
What proposals right now are floating around that you might be able to get behind?
I don't understand why we can't just do a clean extension of what we just had in place earlier this year. I think that is the easiest and most accessible, no-nonsense thing for us to do, especially as the year is coming to an end. Let's extend it. If they want to fight about it, they can fight about it later. But I just don't understand why, in the meantime, we can prevent a lot of people's suffering by doing a clean extension of these subsidies while Republicans figure out what their health care plan is.
There was this group of Democrats in the Senate who said, okay, in exchange for voting to reopen the government, give us a vote. They got their vote, but nothing has been done on this. Do you think it was worth it? Do you think that strategy of the shutdown and also what they did was worth it without a resolution to the problem?
Well, we have to remember who's in charge of the House, the Senate, and the White House. Republicans have a House majority, they have a Senate majority, and Donald Trump is President of the United States, and J.D. Vance is the Vice President of the United States. We have exerted, as Democrats, every point of leverage that we've had in this moment to try to demand votes, to try to demand a pause so that we can address this issue, and every single Republican in governance has refused to engage this matter. Meanwhile, people are going to be kicked off of their insurance. Open enrollment is happening right now, and there are going to be millions of Americans that are affected, that aren't going to be able to go to a doctor, aren't going to be able to afford their prescription drugs because of some petty fight in Washington. And I think it is the lack of urgency and the lack of care on this issue is so indicative of how disconnected people are from the real life consequences that people are experiencing because of this. People are going to die. And I don't understand why they can't just extend these subsidies so that we can save people's lives while they figure out whatever their political food fight is.
Is an extension with those abortion restrictions better than no extension at all?
An extension with abortion restrictions kills women. So no, I'm not going to allow this Republican majority to kill women in this country so that they can try to do whatever their victory lap is. I will not accept women and the lives of women as some political cost for them being able to extend these things. Reproductive care is health care, period. We're not going to do this thing where we say, people can get health care but women can't, or people from this geographic place can't, or that geographic place can't. We need to legislate as Americans, and we need to legislate for this country.
Thank you. Thanks.